Palo Alto Networks, the next-generation security company, has released findings of independent research into the state of cybersecurity within the NHS. Working with Vanson Bourne, 100 NHS IT decision-makers were surveyed on the importance of data security in the wake of recent cyber-attacks, preparedness for forthcoming tougher data protection rules and the development of trust when it comes to how patients digitally interact with the NHS. The study reveals NHS IT managers' awareness and understanding of how the Department of Health is planning to radically change cybersecurity requirements for healthcare providers. The vast majority of respondents, 90%, believe that prioritizing cybersecurity in the NHS will unlock the potential of digitalization to improve patient care. They also agree that cybersecurity investment could enable substantial savings in the long run, 83%, saving £14.8 million nationally each year on average. The survey's respondents estimated that improved cybersecurity would save enough money to allow for an additional 150 doctors and 250 nurses within the NHS. All respondents agreed on the importance of keeping data secure. The benefits of cybersecurity are believed to have a wide significance. 65% believe that it would improve the level of patient trust, almost half, 49%, think it would line processes, and 45% see long-term cost savings as a result. With recent cyber attacks such as WannaCry affecting frontline services, NHS IT managers say that more can still be done to cultivate a robust and widespread cybersecurity culture within the NHS, through improved training and education. However, while 41% felt that all staff should receive specific training, only a minority of NHS IT professionals said that frontline staff who accessed IT systems receive cybersecurity training, such as administrators 30%, doctors 11% and nurses 6%. In a sector that is increasingly digitized and reliant on data, patient confidence in how their data is used and stored is essential. The research found that IT decision-makers mostly think that patients have a good to complete level of trust in how the NHS uses or stores their data, 81% and 67%, respectively. However, a quarter of respondents believe that patients have minimal trust in how the NHS stores their data. More than 1 in 10, 16%, also reckon patients put very little trust in how their data could then be used by the NHS. In order to tackle this trust gap, prioritization of cybersecurity is seen as key, 89%. Digitization can reap considerable benefits for NHS patients and staff, yet the capacity to save money and improve patient care through more seamless digital processes is dependent on how the NHS leverages cybersecurity to maintain trust, while capitalizing on its exponential data growth. Preventing successful cyber attacks will be paramount in reducing disruption to medical services and improving patient trust, leading to the greater ability to use data to improve health outcomes, said Dave Allen, Regional Vice President, Western Europe, Palo Alto Networks. When it comes to GDPR, IT decision-makers within the NHS are generally informed about the changes coming into effect in 2018. Register now, BUSINESSCLOUDS GDPR. Are you ready? Event 83% have had guidance from senior management about compliance, and 95% say they are aware of what they need to do to comply. The majority of respondents, 58%, think that their NHS organization will be ready for GDPR by May 2018, and 16% even believe the NHS is already compliant. Nonetheless, more than three-quarters, 77%, realize that their organization's IT systems still need improving to ensure data handling compliance.